The camaraderie, the mentoring, the relationships is so important in this industry.
Don't go breaking my heart.
We couldn't if we tried.
HPN in 2013 we came out to form a team.
At Heritage Provider Network, it's all about teamwork, and the 5th annual leadership retreat was no exception.
We'll be learning about how we can engage our PCPs in that patient experience.
Overlooking the stunning Pacific coastline, the message, Team Up for the Future, was reinforced by Dr. Richard Merkin, President and CEO of HPN.
The goal is to understand that collaboration, working as a team, understanding that technology and business innovation is vital to the improvement of healthcare in America, so families in America can afford healthcare.
Guest speakers for the 3-day retreat focused on engaging our providers in the patient experience.
I would start with really being quite precise about what does success look like from the patient perspective. It is a system issue, it is a process issue, and I would make sure that that provider has first the understanding of what the patient needs, and B, the tools to make that match.
How do you distinguish between people who are just want the job and who are really excellent?
Excellent question. And so we really gravitate toward behavior-based questions, how to hire for service excellence. And what you're doing is you're watching and you're listening and you're saying, tell me about a time when you had to deal with a very difficult patient.
Dr. Merkin led an insightful conversation with Stephen Cloobeck, chairman of Diamond Resorts Corporation, on the meaning of yes.
This is a real live a doer. Remember yesterday we said there are talkers and doers? This is a doer.
Teaching your team to pay attention and then delivering great service levels is what the meaning of yes is all about. And it's not that difficult to do, and it's not that costly, and it transforms in a concept to really any business that's consumer facing.
In our world, the government is asking us to do more. The patients are asking us to do more. The health plans are asking us to do more with less. Do you think the patients understand that? Our customers understand that? Or do they say, that's your job to solve those problems?
It is 100% your job to solve those problems.
We're not competing. Our competitors are not in China. Our competitors are in a garage in Silicon Valley. Someone is working right now as we're talking to disrupt us. Each one of us should either realize that either we'll disrupt someone else or they will disrupt us.
And exploring the role of technology in that disruption regarding the future of health and medicine is Dr. Daniel Kraft.
The patient of the future, and increasingly of today, is the engaged patient. They want to understand and own their own healthcare information. They want to be the CEOs of their own health. It's not like I just go to the doctor and he or she is responsible for my medical care. So in some cases, some really want to be engaged. Others, in terms of dragging them along, well, it's where the incentives lie. Insurance premiums can go down $100 or $200 a month because they're demonstrating that they're eating healthy and going to the gym and exercising and sleeping well. That can change behavior. If you can show that you can even give them a tablet with an app that helps track and manage their chronic disease, that can help engage them and pull them into today's world. And for the clinician as well. Clinicians practice often sick care, not health care, as we incentivize outcome-based measures. And if I'm a primary care doc and I get rewarded for having a panel of patients with better blood pressure control or hemoglobin A1C, and I can use some simple tools and apps to do that, I think that will help drag us all into this current century of technology.
When you think about exchanges and duals and a lot of other healthcare reform, it's really an unprecedented opportunity. You're going to see a lot of people changing their insurance plans rapidly. So they estimate that about 35% of people will churn every year between the Medicaid program and the exchanges. The dual eligibles are going to be enrolled in new plans for the first time. They're going to be coming in, they're going to be coming out. So it's a risk because, yes, you could be losing patients. And it's also an opportunity because so will your competitors.
What are the key elements to onboarding a new dual member so that you don't lose them in the first 6 months?
The thing about duals is really the non-traditional medical expenses that are now covered. I mean, when they see you as a friend, somebody who's helping them, they don't even say, wow, now Medicare covers this. They don't know that. They just know, wow, they really care about me as a person.
Cheers. Cheers to working together. Yes. Teamwork. And everything else that goes along with it.
Yes.
Meeting colleagues in informal settings brings opportunities to exchange ideas over dinners and lunches, with family members welcome too.
I think the value of a retreat is to be able to get everybody away from the phones, away from their day-to-day setting, and actually sit back and reflect and be able to take back new directions and new methods so that we can take better care of patients.
Customer service is something that we've really been focusing on in Bakersfield and San Luis Obispo in the last year, and so the timing couldn't have been better.
Dr. Merkin built this company on camaraderie and collegiality, and because of that camaraderie, I think relationships developed that allowed ideas to fertilize.
We're in a complicated business, and we want to provide the opportunity for our leadership to talk to each other and share best practices and the social time and have fun too.
The energy level here is enormous and amazing, and to me it's a collaboration of a lot of different folks from a large organization coming together. It's an opportunity to meet new folks. It's an opportunity for me to look at the practices, what's working, what's not working, what we can bring back.
That's what we're going to take back to Arizona and say, who's out there working out of their garage or out of their home that's going to make us obsolete?
While you're doing things, you have to stop and then redirect things and looking for new things all the time, so to improve. That's the key of success.
HPN's best competed to successfully create a hole-in-one challenge, an exercise in team building.
A challenge was given to us in a limited period of time. We looked at the situation around us, the terrain, if you will, and we came together as a group to look at tactics. What can we do to distinguish ourselves in this competition to really make a difference? And I think with the tools that you made available, that the teams made available to us, we figured out how to take the tools that were at our disposal and use them more effectively. And then last but not least, we wanted to win. We wanted that treasure. So we took all of those things we've seen over and over again discussed in this meeting, and we put them to work, and I'm happy to say we walked away with the win.
And what better way to celebrate that team win than a good old-fashioned country hoedown?